Hi, I'm Damon Haycock, Community Engagement Director with Benefitfocus, and today I have Christin Deacon, the Director of Health Benefit Operations, Policy and Planning, and Assistant Director at the New Jersey Division of Pensions and Benefits. Welcome, Christin.
Thanks for having me, Damon.
Well, thanks for attending. Now, you have a great story. You did not grow up in healthcare. You have a non-traditional career path into your role today. Could you tell us a little bit about that?
Sure. I'm actually an attorney by training and practiced in the corporate restructuring world for almost a decade. Um, and then I started a family, sort of burnt out on that private practice grind, and moved to public service, where I started at the Attorney General's office, and then moved to various places within state government and eventually landed in the Treasurer's office, which actually houses the Division of Pensions and Benefits and the health benefits program for the state health benefits and school employee health benefits program for the state. Along the way, I sort of touched healthcare at the Attorney General's office and the governor's office, but when I went to the treasurer's office, they asked me, I was honored to fill this role and haven't looked back. So,
How long have you been in this current position?
almost 2 years. And prior to that, I ran some of the larger projects for the state health benefits program and school employee health benefits program.
Awesome.
Yeah.
So why don't you talk a little bit about the health program and highlight some of your impactful programs?
Sure. So I'll just give you a sense of our size and the populations we service. We have about 820,000 lives in all as of last count. And we cover, all state employee and dependents and retirees, as well as local governments and school districts that opt to participate in our program. We have about 70% of the municipalities and local governments in New Jersey and about 30% of school districts, and always looking to grow that number. We have, obviously we're self-funded on the active and early retiree side, and we have a Medicare Advantage product for the majority of our retiree population.
Well, you are definitely a force to be reckoned with in the size of health plans. Hopefully that adds a lot of purchasing power to the things that you are accomplishing. But kind of on that note, what have been some of the biggest challenges that you've experienced with your program?
At that size, you're right. Certainly, one would think that you sort of can set the marketplace and you do have the power of, purchasing power with that size. That being said, our governance structure is quite unique in all of the stakeholders that we have to bring along. So our plan design is actually set by a plan design committee that is composed in equal parts of both management and labor. That's when we're all on the same page. I think that's certainly something that is beneficial, but it can also be, difficult to bring everybody along. And so when the plan design is sort of outside of your control from a political perspective, it makes some of the initiatives, whether it's carrots or sticks, a heavier lift. But like I said, I see it as a challenge, but often as an opportunity, because when everybody's on the same page, those leaders in that community can really be instrumental in driving engagement and driving engagement in initiatives that are going to be high value to the state.
So speaking of some of those high value initiatives, I'm of the understanding that you have done a couple of pretty innovative things. One, you implemented market checks and reverse auctions on some of your contracts, or at least one of them.
Right.
How did that go? How did that come about, and what have been the results?
Yeah, and that's a great example of where management and union leadership came together and said, this makes sense, right? So on the reverse auction piece, we've conducted 2 reverse auctions for our pharmacy benefit manager contract, which is credited with saving over the life of both of those contracts over $2 billion for the state. So, I mean, really substantial savings. And then within that contract that we procured through the reverse auction, we've also secured, the right to do market checks on a biannual basis, so twice a year, And we've exercised that right. And it's really been of tremendous value in, both our renegotiation of extensions and seeing where the market is. So, it's been a win-win for our members. It was immediate savings that we were able to achieve through contract and not, having to shift costs to members. So yeah, it's a great tool. And I think thinking about things like reverse auction and procurement creativity, if you will, and how we're procuring services is something that state health benefits programs like ours can really benefit from, thinking outside of the box on procurement.
And just a last question on the market check. For those that aren't aware of how those are conducted, can you just briefly touch on the high points? What would a plan do if they were interested in doing a market check?
Well, I mean, at first, I think, any contract you have, you want to make sure that you preserve your right to engage in that market check. We actually outsourced those that service to Truveris and TrueGuard. They're the company that ran our reverse auction and actually review our claims on a real-time basis and make sure that our PBM is performing to the contract. But it forces the PBM to go out to market and make sure that we're getting the best deals for the state. So yeah, I would encourage Damon. You actually, I remember at one of the first state and local government benefits association meeting, and you said this is something everyone in this room needs to do. And I took that and I ran with it and I made sure it was in our next RFP.
Well, that's awesome. I'm flattered. Thanks for sharing that. Just another addition to it. Generally, right, you find a third party that can go and query the market to see what is the going rate for admin fees for the different drug types, especially on the PBM side, of course. And then they come back and say, you are getting a great deal, or maybe you could be getting a better deal. And it really empowers you to renegotiate with your PBM so you don't feel that you're stuck paying certain high costs when the market has changed and become more competitive, right? That's my understanding, and that's what I was trying to share a few years ago now. So this is kind of cool. Your agency is your health program is part of a larger agency. It's pensions and benefits.
Right.
Often I've seen in my world, my circles, that sometimes pension will overwhelm the priorities because of its size and its impact to the lives of retirees. How have you been able to address issues knowing that you have to sometimes fight for priority levels?
Yeah, I mean, that's a great point. And I think when organizations were formed that sort of put those two pieces into the same bucket, benefits. It was at a time when health benefits weren't really at center stage like they are today. They certainly weren't taking up 20% of our GDP healthcare costs. On the pension side, I think, most states would say that, the pension liabilities are the pension liabilities, where health benefits can be a little bit more fluid from a cost perspective and a savings perspective. So, fighting for resources is certainly an issue for us, as I'm sure it is for every state government or public sector. In engaging with your pension information versus your health benefits information is very different. So trying to tailor and customize the way that we're talking about health benefits versus the pension side is really important, and to not, not just lump them together like they're the same. Again, how we're communicating, how we're engaging with our members, it really has been a cultural shift, and one that's ongoing and that we'll keep working on.
So tell me something you've done innovative lately. What's been top of mind? What has been some of the coolest things that you've been working on so far?
So one of the most recent, recent initiatives that is in the public sphere at this point, right, is what we're calling the Garden State Health Plan that we are putting together with our school employee health benefits program plan design committee. It was actually dictated that we create this plan by statute, but what the plan looked like was really up to the plan design committee that is supported by, the administrative staff at the division and my team. And the resolutions that were passed require us to procure a vendor to put together a customized network. So we're thinking beyond the BUCAs, and sort of a direct contracting relationship with our hospital systems in New Jersey to create an integrated delivery network for our members. And we're really excited about that. We have a number of other initiatives underway, expansion and capitalizing on telehealth and telemedicine, digital innovation. We were on the path to do a lot of this work prior to COVID, but COVID's just has been such a catalyst for adoption and engagement. And, we're here and hoping that we can do the right things to make that stay. Expansion of our mental health and behavioral health networks through digital innovation, provider search optimization tools, really trying to get the most value out of the benefits that our members and our tax-paying public, pay so much for.
Right, for sure. Speaking of COVID,
Yeah.
how has that affected your program? What have you had to pivot or to be flexible on? What changes have you had to make, or were you so large you didn't have to do too much because you could absorb those costs and those services?
Yeah, so COVID it's obviously been an evolution since March, and what we're looking at and whether we're focusing on testing or vaccine deployment. As I said, we were well poised to meet our members' demands for telemedicine and telehealth and digital solutions because we were in the process of doing those things pre-COVID. It's just helped us with our engagement. Long term, what we're thinking of, are we going to continue to incentivize the use of telemedicine through no cost share to members? Are we going to continue to pay at no cost share COVID treatment, and some of these things are federally or state mandated. So it's thinking about what, once we come out of that public health emergency, what will be the new normal, and just thinking about smart plan design in that way. I do have to say, because of our size, which can be a great thing in so many ways, but it can also be challenging for us to really pay attention to the details and to the outlier claims, whether it's on like an out-of-network COVID testing scheme. When you have 820,000 people, it can be very easy to assume that we're asleep at the wheel on those things and that somebody is looking out for our claims. But we have seen outliers in the hospital data and COVID tests being run, 10 times for a person inpatient stay, and us paying a percentage of charges with no controls. So we have to make sure that we're very aware and cognizant of, the storm that is COVID, and making sure we're paying attention to all those details. Because again, this is our public employees' money, this is taxpayer money, and we're stewards of that. And so we have to pay attention to those types of things too.
That makes sense. You've mentioned a few times about your dealings with the unions, how impactful they are to your program and your ability to provide services to your members. So obviously you serve the state and local government, but when you do negotiate with unions, how has that process impacted your ability to innovate? And if you could wave a magic wand, what would you do?
Oh, if I could wave a magic wand, what would I do? I think that, to my point earlier, that the partnership, if it's seen as a true partnership, it can be invaluable, right? Like members, when we talk about regaining trust in healthcare, that union leadership and that stakeholder leadership can really be powerful for your members to trust what you're trying to do in innovation. So if it's a centers of excellence approach and your union leadership firmly believes that their members are going to get higher quality care at that centers of excellence, that's only going to make your program more successful. So it's forming that relationship from the outset. making sure that everybody is rowing in the same direction. And for me, that's, when you look at the number of initiatives or reforms or ideas, it's about high quality coverage and high quality care, right? It is about the cost savings at the end of the day as well, but high quality will save dollars. And I think if you keep that as sort of your starting principle, that partnership is easier to form. We can't think about, a dollar saved in this hand has to be given away in the other. It's not a zero-sum game in healthcare. I think we all have to realize that we have a lot to gain.
So my time dealing with unions and advocacy groups had its ups and downs, like I'm sure yours does as well. But one of the things that I was able to capitalize on, I'm curious if you do this as well, was once I was able to sell an innovative idea to them, they became my champions. And they were out there in the community. Not only were they talking to their membership, but they hired lobbyists that would come to my board meetings or would go to the legislature. And they would stand up there after I presented or testified. This is this great new Damon idea I want to do next year. And they would say, we firmly support Damon Haycock and his program. And that was gold to me. Like that was credibility 101. Have you experienced the same type of situations with your unions? And do you have any stories like that you could share?
Yeah, I mean, I think not only make them champions, but bring ideas that they can take, credit for in bringing to their members, right? They want to show value and the value that they bring to their membership. And so, like I said, even more than being a champion of somebody else's idea is being the sort of the bringer of that idea.
Yep.
And being the deliverer. I mean, I would say that the reverse auction is probably a good example of a real partnership that was driven by both union and accepted by management. Another great thing we're doing in New Jersey that I'm really excited about, and I actually posted on my LinkedIn yesterday, my first meeting with a direct primary care medical provider. So we have around, I think it's 15 direct primary care medical homes around the state that are dedicated to our membership. And that is, it's an idea that is very strongly supported by the unions. And, at the end of the day, direct primary care, I think, is going to be a real game changer for us. And it's actually made part of that integrated delivery network. So, I'm taking their lead on that and just giving them all the tools and resources to really elevate that program for their members, because it has tremendous value for them, I think. And for
That's awesome.
Mm-hmm.
So I think I was the first one to mention the legislature. So your legislature is in session right now. And is there any bills yet that has been introduced that has surprised you, or are you monitoring any specific bills that are going to significantly impact your program?
There are so many bills that impact our program that are out there. I think if you were to query our legislative site, you'd probably get, hundreds of return that involve state health benefits program in some way. But how many of them are actually going to move? Now that's another question. Some significant bills of note are the reorganization of Horizon Blue Cross Blue Shield structure in New Jersey. So moving from a charitable organization, sort of a creature of, it's a strange hybrid right now, but then moving to just straight nonprofit. So that reorganization we're paying attention to. There's another bill on the queue regarding reverse auctions generally. So moving outside the PBM space and for other services utilizing reverse auctions, which I think is interesting. Yeah, I mean, there are really just a number that we're paying attention to, but we don't comment on, other than giving like fiscal notes. We don't comment or support or, outwardly legislation.
Go testify in the neutral position at the end and just share data.
Yes. Yeah.
So how's your budget going? A lot of folks are cutting their budgets due to COVID or due to just generally high cost healthcare. What are you guys experiencing, and what are you doing to combat any of those types of situations?
Yeah, our budget, it always feels like budget season in state government. Everybody thinks there's a season, but it's really year round, or we go from one season to the next. We're facing all of the challenges I think that every other state government or local public entity is facing. Um, from the health benefits perspective, I think at least for my time in state government, there hasn't been a budget cycle that hasn't looked to health benefits for savings, right? So we're our own worst enemies in that way because we've been able to deliver in most instances, um, either substantially or completely with the savings requests that are made of us. Um, and I think we'll be well poised to do that this year. We have some really innovative and unique ideas that we're looking to bring to the administration this year. And what I really like about most of what we're talking about is none of it's cost shifting to a consumer. None of it's it's about being most efficient with our healthcare dollars. So yeah, I'm sure we'll be combating trend. We've had either flat or negative trend for the last couple of years, so I'm hopeful.
I understand. I remember those days, always trying to stay ahead of inflation.
Yeah.
All right, so let's shift to something a little bit different here. Tell me something most people don't know about you.
Hmm. Let's see. I would say I'm hoping that this changes soon, but one of the reasons I really have found a love for care is my passion for like mental health advocacy. And I'm trying to speak more openly about, mental health, both from a leader perspective, but also, talk about my own personal mental health struggles throughout my life to reduce stigma. I think we can talk about it in panels and talk about it, on 12th floor boardrooms about um, changing the culture of our workplaces and society. But I want to walk the walk, not just talk the talk. One of the first webinars I did post, after COVID hit, we did a mental health well-being and stigma reduction webinar, and I took this leap of faith to say I'm going to share my story, and I haven't looked back. And I have had a lot of really positive feedback from people that said it was meaningful for them. So again, maybe it's something most people don't know today, but I hope to change that.
Do you miss some of this face-to-face interaction with your peers across the nation? We ran in the same circles for a few years, and I'd see you at all the big events, but we haven't been able to really go anywhere. We haven't been able to have these types of conversations sitting at a conference after a session, picking each other's brains, even on a 30-second elevator
Right.
ride. Do you miss that interaction? And if so, what are you doing to fill that gap?
Yeah, I think I'd be lying if I say I didn't. I definitely miss the interactions, but as we've settled into, over the last few months, I think we've all made a concerted effort to try and recreate that feeling in the virtual world, right? The silver linings are, listen, if I was in Trenton commuting every day and you are where you are, would we have had this opportunity to do this interview? Maybe not, right? Like I certainly feel in some ways my world has become very small because I'm, broadcasting out of my bedroom and home office. But in a lot of ways, it's expanded because I've been able to have these kinds of conversations with thought leaders like you and others, and grow that network. So it's been a trade-off. And I will certainly look forward to that next beer or soda in a cafe before a meeting. But I think we're doing the best we can. And there certainly are some silver linings to what we've experienced over the last few months.
I think that's an excellent positive attitude to take. And there's a half of me that misses traveling and being in front of folks and having these conversations face to face. but I do love being able to just get on and talk to anybody at any time and really schedule a lot of interaction in
Right.
a short period of time because of technology. Technology is amazing and it just keeps getting better and better.
Right.
So what keeps you up at night, Kristen?
Other than my 2-year-old, um, let's see. I think all of the moving pieces and innovative ideas that we've put in place, I really want to make sure that I'm able to focus on execution, right? Execution and engagement. Uh, I would like to think as well that the type of work that we're doing and the type of disruptive approaches that we're taking um, also keep some other people up at night, right? So whether that's like hospital executives, and not that we're out to get them, but just different ways of delivering care that's really consumer focused, and disrupting the status quo that really isn't working. It is working for some people. It's not working for our members and the taxpaying public in getting the most effective, efficient, and high quality care for the best price.
Well said. I know I've been canceled off of a few hospitals' Christmas card lists, so I feel it. So what's the next big opportunity for you, Kristen? What's the next big opportunity for New Jersey?
Well, for me, like I said, I think for me this year is about, obviously there's a large piece about, that COVID takes over my day to day, but it's about execution, right? I think that we've done a tremendous amount of work in getting a lot of the tools in place for our members, and now it's engagement. Um, and again, I think, trying to keep that positive attitude, there's a lot of opportunity that, COVID has presented us with as healthcare professionals. There's a lot going on in the federal, on the federal stage from a rulemaking perspective with transparency. How do I make the most of those transparency requirements? I think last I looked, only 30% of like New Jersey-based hospitals were compliant with the HHS rule that went to effect Jan 1, 2021. So I'm excited about what some of these rules have, the potential they have to be disruptive and how we can utilize that. And as far as Kristen, I'm enjoying working from home, but I am looking forward to getting back to an office and interacting with my peers again.
You ever plan on practicing law again?
Absolutely not.
So we have a myriad of folks that may be looking at this when we're finished. It could be large states like yourselves. It could be small school districts that are just trying to get some insight into what somebody like you has been able to accomplish or some of the things that you're looking at. What would you tell like a new administrator looking for insight into running a cost-effective, successful program of benefits? They could be self-insured, maybe they're fully insured, maybe they're large plans, small plans, and anywhere in between. Yeah. What's the wisdom of Christin Deacon you can share with us today?
So my nugget would be, and I probably stole this from one of the many healthcare podcasts I listened to, is to always begin with asking questions about financial incentives. Look for the trail of financial incentives in any relationship. And again, this is for, a plan of our size or a plan with a few hundred or a few thousand. Where are those financial incentives lining up and do they work for you? And my guess is going to be that you will find in healthcare that there's very few instances where those financial incentives are going to be fully aligned with you as a self-funded plan. So if you start any analysis of whether it's a point solution or a contract, look for the financial incentives. It's illuminating, it's at times disturbing, but it'll give you a great insight into this industry and what's possibly wrong with this industry in some ways. So that would be my nugget, I think.
I think that's awesome.
Yeah.
If anybody watches this and they happen to have some questions or they'd like to learn a little bit more about things like reverse auctions or market checks, are you comfortable with them reaching out to you? Can they shoot you a note and say, Kristen, I'd love to at least get a couple bullets as to what you did on X, Y, or Z? Is that something they can do?
Yeah. I think in this space, we all have to be each other's, partners in learning and learning what works, best practices, what doesn't work. And if I don't have an answer, I can, because we have relationships like this, Damon, I can put you in touch with, a state or a peer in a different government agency that might have more experience in that area than I would. And then there are the, organizations like whether it's SALGBR, National Academy of State Health Plans, or NGA. And the more that we talk, because we are aligned in addressing some of these issues and have similar sort of populations, the better.
That's awesome. No, I agree wholeheartedly. We participate in all those associations as well, and it's a really great place to get some of that thought leadership that you're yearning for, especially when you're stuck in the same four walls every day during COVID. Help
Right.
you get a little bit more educated. So, Kristen, that's all the questions I have for you today. Is there anything you want to share with me or with the audience that may be watching this to help bring it to a close?
I would just say one more nugget of advice for anybody that might be like in my position or something similar. There's the thought leadership, and there's the innovation, and there's the coming up with the ideas. I would say the hardest part is not that bucket. It's the hard, difficult day in, day out work of making those things happen. Whether it's project managing the onboarding of a benefits administration platform, or it's working with your TPA to drive a harder bargain with a hospital, or implementing a claims review system. It's a constant. I use the word battle because that's what it feels like. But just stay at it. It's hard work, it's good work, and it's rewarding work. Something I remind myself of, often is that I might not be able to change the world, but in healthcare, we can change the world for one person, right? Through some of the decisions and things that we do. So stay at it.
That's a great way to end it. Stay at it. So, Christin Deacon from New Jersey, awesome. Always a pleasure talking to you. Thank you so much for taking the time today to speak with me, answer these questions, and being so very personable and sharing of the things that you're dealing with both privately and publicly. So I want to thank you for joining. This has been awesome, and we'll speak soon.
Thanks, Damon.
All right, take care.
Bye.